Welcome to another episode of Silver Linings Talk Show. This is our November episode to honor or bring awareness to diabetes in November. We have with us Dr. Lucille Hughes, President of Diabetes Insights, and the title of this episode is Thrive with Diabetes, Tips and Tricks to Live Well with Diabetes. And I love that so much because I think this is such an important topic.
Absolutely, yes.
Yeah, so you can tell us a little bit about you.
Sure, I'd love to. So I am a nurse first, that's where my doctorate comes in. I have a doctorate in nursing practice, and shortly after I began my nursing career about 40 years ago, I literally fell into the diabetes space and just felt this passion working with individuals at risk for and living with diabetes. And soon after I found this passion, I became certified in diabetes education, then later board certified in advanced diabetes management. Just wanted to keep going, and eventually president of the Association of Diabetes Care and Education Specialists in 2023. And that wasn't enough. So I decided that this year, this past June, rather than just being able to help people living on Long Island, that I would open up Diabetes Insights, LLC, so that I could reach people across the country. It's a virtual platform so they can make appointments to work with me, and I can help them thrive and live a long and healthy life with diabetes.
I love that we have like the best professional here
talk about
to
an
talk
expert.
about this topic.
Right.
And certainly let's kind of dive in. I'd like to know, and I'm sure our viewers would like to know, kind of like talk about the differences between pre-diabetes and
Sure.
type 1 and type 2, and then we throw in a little
Gestational.
Gestational.
Yeah.
See that.
So there are different types of diabetes, obviously, but the most popular ones, we talk about pre-diabetes, and then the clinical diabetes, which is type 1, type 2, and gestational.
And I think we have some photos to go along with
Oh,
this
great.
conversation.
Great.
Yeah.
So in type 1 diabetes, we'll start there. That's actually an autoimmune disease. So similar to like lupus or rheumatoid arthritis, where the body turns on itself. It really does. Something gets in, and it sounds vague, right? It sounds like, oh, what is this something? We don't know, because if we did, we'd have a cure.
Right.
So something gets in and looks at the beta cells, which are the cells that make insulin, and says those are foreign objects, and starts to kill them off.
Here we have
That's
picture
the
of
life
the
cycle.
life cycle.
Yeah. So what you see there on the left is we know these individuals are exposed to something, right? This invasion. Sure. And as we move along, they build autoantibodies. And when they get to that stage 2 of type 1 diabetes, so it can get a little bit confusing, that's where we have now found a treatment that could postpone. It's not a treatment as a cure, but we can postpone the development of stage 3, which is clinical diabetes. So we're working on that, and that's why it's really important that individuals with type 1 diabetes, they have their family members screened, because we want to catch them at this very early stage so that we can postpone the onset of stage 3, but also we want that smooth landing. Unfortunately, many times with type 1, they end up in what's called diabetic ketoacidosis, which is a hospitalization, and it's a critical condition that could affect mortality later on.
Sure.
So we want to prevent that. So that's type 1 diabetes, and actually 5% of individuals with diabetes have type 1. 95% have type 2. That's hereditary. And that actually starts off with pre-diabetes, which a lot of people don't understand.
That's such a huge perspective that you've just given us.
Yeah.
Just to know the difference, because I don't think a lot of people would know that.
And think about this, 38 million people have diabetes. 98 million people have pre-diabetes. Wow. Okay, those individuals are going to eventually have type 2 diabetes if they don't do some kind of action. And what I mean action is we want to encourage weight loss. We want to encourage healthy, mindful eating, which we'll talk about in a little bit. We want to encourage physical activity. Notice I didn't say exercise, because that seems to be like a bad word these days. We said, can you be more physically active? So it's all about, the correct language that we want to use in diabetes today.
Sure.
So pre-diabetes, unfortunately, has been referred to as borderline for so many years. And if you think about adults, we don't do something when we think, oh, it's borderline, we're on the good side, right? We don't put ourselves on the other side. So words and language such as borderline does not help people.
Language matters.
It matters in everything.
Yes.
So we want to encourage people with pre-diabetes, obviously, to work with someone like myself, a certified diabetes care and education specialist, but seek help to improve their life to prevent type 2. And then, of course, we have type 2 diabetes, which we know is pandemic, right? There's so many people living with type 2.
95%.
We do. And that, again, is hereditary. So it's not that, when people say, oh my gosh, I should have listened to, my doctor, I should have lost weight, I should have done this and this, and now I have type 2, and they start blaming themselves because they may be overweight, they may have other comorbidities, when in fact, you were born with that gene. Something made it express itself at a certain part in your life. So we just want to bring out the positive side to having diabetes rather than just always looking at the negative.
Yeah, Diane, I think you wanted to kind of mention something about that.
Well, that is near and dear to my heart because my husband has the type 2 diabetes. And you had mentioned in our conversation earlier that there's actually a positive side to type 2 diabetes. And I love that because I've never heard of that before. Can you tell us about what's the positive side to type 2 diabetes?
Absolutely. And I try to really, again, focus on that when working with individuals because, nobody wants to have diabetes, let's be honest. And they're going to say, well, sign me up for that. That's something I want to get in my life. No.
Yeah, right.
But what I try to do when I'm working with individuals is to say, well, let's look at your life right now. What brought you to see me or what brought you to that diagnosis of type 2 diabetes? Many times, again, they have weight to lose. They're not physically active. They might have high blood pressure, high cholesterol. And when they start working with someone like myself or a coach, right, and we look at ways to improve positive behaviors, not, they're life-changing, but they're not difficult. They just need to be done. Eating, mindful eating. We don't call it a diabetes diet because there is no such thing of it. But mindful eating, being more physically active. And when they start doing that, they become a healthier version of themselves. Their diabetes is better managed. And my message to those individuals is, now that you have type 2 diabetes, that brought you here to start making changes. You're gonna live a long and healthier life with diabetes than you would have without it.
So that is thriving.
That's thriving.
I really like that perspective because we don't want to call it a wake-up call either. We just want to call it maybe it brought them an opportunity to call to action.
Yeah.
And it called them to make actions
that are going to pay off positively.
Yes.
That's
awesome. We had also had a conversation about GLP-1s being one of those tools that can potentially truly help them in their weight loss and
journey. Absolutely.
Yes, in the journey.
Absolutely.
Yes. I like that it's called
when I think about where I was 40 years ago, so when I started in diabetes, we had insulin and we had 2 classes of medications, which were, a class called sulfonylureas and TZDs, which is glitazones. That was it. So everyone was like a cookie cutter. If you had diabetes, you had to go on this, and we didn't really match what that person needed. We hoped that it worked.
Right.
Now today, we have so many options, so many medications, so many therapies, so many tools, not only medicine, we have tools that can help people thrive and be successful living with their diabetes. The most recent was getting a lot of attention are the GLP-1 receptor agonists.
Yes.
And we have the GLP-1, and now we have GLP-1 and GIP, so sometimes we have dual agonists medications. And you have to understand how they work. In our gut, we have gut hormones, GLP-1, and they help the body take food slowly through the digestive tract so a person feels full. Then they stop eating, right? It tells the brain, I'm full. It keeps the beta cells that we talked about earlier in the pancreas, it allows the beta cells to put out insulin just enough for what they need for that meal, so there's no risk of low blood sugar. And when we give individuals these medications, GLP-1 or GLP-1 and GIP, they get to finally feel satisfied, they're feeling a satiety, and then they lose weight.
It makes sense because it's possible that those receptors weren't effectively working for them, maybe?
Is that what was going on?
Yeah, the way I try to explain to patients is, when you check the oil in your car?
Yeah.
Well, you need these gut hormones, but in some people who say you're about a quart low, you didn't have enough of them. So they never felt full. They didn't want to be heavy. They didn't want to gain weight. They just want to feel full. So that's what these medications help individuals.
And I know Diane had a firsthand experience with that. Correct,
Yes,
Diane?
I mean, my husband's lost about 65 pounds now from
Wonderful.
the GLP, yep. So it's working marvelously because he did eat well and he did exercise. It just wasn't ever enough. So it's been amazing. I will say though, he went for a colonoscopy yesterday. I dropped him off and they sent him home because you have to be off of it, I guess, for a whole week before you can get a colonoscopy. So they didn't see that on his chart, and people should know. Yeah, that it does slow down how you hold the food. So
that's what we worry about. Yeah, I'm sorry that happened to you, because they're usually very astute to that, and we do want patients to be off of it because, remember, it slows motility.
Oh, yeah,
So
yeah,
we're going to
yes.
put you under anesthesia. We don't want you to aspirate. So there is a reason for it, but I wish they had caught that, and then that wouldn't have been his experience. So that's especially going through a prep for
I've heard that
colonoscopy.
too, yeah.
You know, it's the
He
last
lost
thing
a
you
few
want.
extra pounds doing the prep.
Of course, yes, that's good.
Don't we all?
Yeah.
So you started to talk a little bit about treatment options and insulin. Is there any other pieces that you want to include for type 1 or type 2 for treatment options?
Sure. The thing, obviously, for type 1 diabetes, treatment is the drug of choice. It's critical to keep that person alive. And what we celebrate today is the different tools we have to administer insulin. So it's not just the vial and syringe that we used to have, although it still works great, right? True and tried and true. But we do have now pens. We have insulin pens. We have insulin pumps. We can inhale insulin like an inhaler. So what's really starting to happen today is more than ever is people have options. So you have to take this. How would you like to take it? And we get to meet their personal needs.
That's really
So that's
wonderful.
helping maybe the efficacy because they're taking it the way that best suits them.
That's exactly
Yes.
right. You know, medications are wonderful, but they don't work if you don't take them.
Yes, and consistency, I'm sure, is such an important piece.
Like, I have had so many patients with type 2 diabetes on insulin, because again, there's that myth that you don't need insulin with type 2. Many do. And I would say, oh, okay, so what's happening at lunchtime? Oh, I go out with my friends at lunchtime. I leave my insulin pen at home because I don't want to take my insulin in a restaurant. So again, it's only going to work if you have it with you. And I said, oh, well, there's tools that we could help you bring it with you so you feel more comfortable administering in a restaurant.
And knowing what their lifestyle is and
That's key.
is really going to help you understand how they can best take it.
Right. Diabetes has to be patient-centered first.
Does
It's
that-
not about me.
What
it's
about,
the patients.
and also too included in that, what about the continued, like those
Continuous glucose monitors.
Yes,
yeah.
that's what I was
Oh my
gonna say.
gosh.
That's
that
gotta be
to
helpful
me,
too.
You know, again, looking at my history in this field, we used to get people bring in their blood glucose monitors, maybe they bring them in, or their log sheets would be messed up with blood on them and food, or my dog ate them. I'd get that a lot, even as adults. But now, and I'd say, okay, so that was one dimension of me looking at a blood sugar, but not knowing where it was going in time. Now with continuous glucose monitoring, I say it brings diabetes into a third dimension, because not only do they see a number of 120, but they see an arrow. Am I staying steady at 120? Is it 120 straight down, but I need to eat something because I'm going to be low soon? Or is it 120 straight up where I need to go for a walk now to bring that down, to mitigate it from going higher? It's a fabulous tool.
Now, can't those also be connected to like smartphones so other people can be monitoring
yeah, we
those
do a
and
lot of
stuff?
sharing. We do a
Yes.
lot of share, especially with the little ones. We can share with parents, but even adults too. They have spouses or their best friend or their parents are, you know, are connected, so they can say, hey, I see you going low. Are you okay? Yeah, I'm on the treadmill. I'm good. And it's just having an extra pair of eyes.
That has to be a huge game changer.
It is, yes.
I love that.
Definitely.
I love that so much.
And I'm just curious, is there any certain type of training that school nurses have? Because I'm thinking about a dear friend whose son was diagnosed with type 1 young, and she would have it on her phone, and if something happened, she'd be calling that nurse at school, or
Right.
the nurse would be calling her.
Yeah.
Is there certain training that school nurses need because they might be seeing children
Right.
with type 1 or type 2.
Unfortunately, it's not required.
It's not
It
required.
isn't. And we all go through nursing school, but again, this is a specialty of
Okay.
mine, right? So I do have compassion for school nurses too. They're taking care of a lot of issues in the school environment, but I will tell you that many of them have reached out to learn more about diabetes, because that's what we care about the person first, right? That's why we went into nursing, and they want to make sure they know as much as they can to take care of that child. So many of them have reached out for school nurse programs, and they can find them online in different colleges. I used to teach one at a local college on Long Island as well. That's
great.
School nurse program.
Awesome.
Great.
That's
Awesome.
Fabulous.
Yes. And, we talked about the GPLs, we talked about treatment options, and now we're getting into food and lifestyle.
Yes, everyone loves to talk about food, right?
I do.
Yeah.
She does.
Yes. And you can imagine, there's so much to talk about when we talk about food. That's a whole class
It's
that I
huge.
do, right?
It's
That's a
huge.
whole class that I do.
Yes.
And particularly that message is, again, there's no such thing as a diabetes diet, and we don't have forbidden foods. We have to get away from that thought, if I have diabetes, I can't eat what I want. Especially cultural foods, we want to make sure that, again, we include what that person really wants to have. So I just brought a couple here because I want to show you how people can run into problems innocently.
Yes.
So let's look at fruit. Here's an apple. Well, if you go to the produce section and you pick out apples individually, who's not going to go for the biggest apple they could find? This is the meal. There's so many carbs in here. It's about 45 carbs. This is actually more carbs than I'm allowed in a meal. Okay. But here's an apple. It's about 22 carbs. This is a snack. Look at the difference in the sizes,
huge
right?
difference.
And the way I like to tell my patients is, buy your apples in a bag. The
they are
bagged
smaller.
apples are smaller, and
They
you're
are.
guaranteed to get the size that you need rather than picking it out individually. Or if you want, split this with somebody. You can still buy the big apple if that's what you want, but you're going to split it. Same thing for the bananas. Look at the difference here.
Big difference.
Okay. Now, is this one banana? It is one banana, but it's about 2 fruits.
Yes.
So 30 carbs. This is the size of a fruit serving for a banana that you can have, and even this might be a little challenging for someone to have. Grapes, this is another one that my patients usually, they say, what,
I just bought them
Lou,
yesterday."
if I stop at 12, I'm not going to even start, because I'm not going to start at 12 and stop at 12. But this is a serving size for grapes.
Okay.
This is the equivalent to a cup of blueberries, a whole cup of blueberries. Now freeze these. This is a wonderful snack that will last you a while. So that's how you can extend
There's
that.
probably more sugar in grapes, though, right?
So again,
is.
it's not about the sugar per se, it's the portion size, right?
Got it.
All fruit is fruit sugar. It doesn't have protein or fat. So
Got
every
it.
fruit is fructose. But how much of it is a serving size?
Yep.
Yep.
Got it.
And I brought a couple of potatoes because people think they can't have potatoes. Again, you can have whatever you want. But when you look at different potatoes, this is a sweet potato. You can have this, but this would be split with somebody else. And this is the size potato. Certainly not the size you're going to get in a restaurant, though, right?
No.
You get
So
a big
you
honking
get a
thing.
big one because they want you to come back. No one talks about, I went to this restaurant, I got the smallest potato you've ever seen. You're not going to that restaurant.
We've been
So-
That is
conditioned.
true.
Right.
We've been
So
conditioned.
split it with somebody, or split it in half, pack it away, and finish that. But I have to spend some time on bagels,
Yes.
because many people think that this is okay, and again, no forbidden foods, but I want you to know what you're eating. So this particular bagel I bought last night in the supermarket, actually, this is about 75 grams of carbohydrate, so more than 4 or 5 slices of bread. So what I ask my patients, I say, but I love bagels, and I say to them, would you eat 5 slices of bread at one time? And they went, oh my gosh, I would never do that. I go, but you are. And it helps them when they see it in that perspective, through that lens. Well, what could I have then? I said, well, how about an English muffin, which is 2 slices of bread, or 2 slices of bread, 2 slices of rye bread. So again, we don't take this away. And I love when they say, what happens if I scoop it out? Okay, you might get it down to 60 carbs, but you're still talking about 4 slices of bread.
Yes.
So we just want to look at, what do you enjoy having, and then what can we substitute that still satisfies you, that makes you feel happy? That's the most important thing. That's our goal.
I love that because it's an education, but you're not omitting.
No,
And
no.
that's what's, because then they're winning, because there's not a no, you can't. It's
Yes.
this is how you can.
And nobody can
Yes.
stick to that kind of a diet.
Yeah,
They
because
can't. It's
what
a healthy meal plan.
Yeah, what I love about that is every time you go into the grocery store, you are faced
Yes.
with that,
Yes.
that
Yes.
question, that dilemma, what do I take? Or I really want that, but I'm not supposed to, right?
Yes.
And now it's about, oh, how can I have it still?
How can I have it? Great, without compromising my diabetes management
Right.
and what makes me feel happy. I used to do supermarket tours.
You did?
Yes, I used to bring patients through the aisles of the supermarket because it is a learning experience and teaching them how to shop that is still health promoting.
That's actually the
Yeah.
best
That's
thing
really
ever
cool.
because I love going to
It's
the
really
grocery
fun,
store,
yeah.
and you can really learn things.
Yes, I say it takes that maze of confusion, think about it, it looks like a maze, turning the maze of confusion into something that is enjoyable and not fearful.
Absolutely.
So Lucille, would a lean protein be better to add with a half of an apple?
So when we add protein and fat to anything, it's going to, first of all, it's going to fill us up, right? It's going to take away from the amount of carbs that you might want to put in that meal. So yes, having this apple with peanut butter, with some cheese, with your sandwich for lunch, not just alone as a snack. We want to avoid having fruit alone. We want to pair it.
It's a synergistic approach
Yes.
in a
Yes.
way. Yeah.
Exactly,
I
exactly.
recently did a little talk on that myself.
Good.
And I really believe that that's important too, because if we're satiating ourselves, then we're not turning around and going, what else can I eat? And
Right.
then we're in a pinch and we're not making
Right.
smart decisions. That's
exactly
a
it.
smart decision,
Yeah.
right?
It's absolutely true.
Awesome.
So another topic that I think is very important to discuss regarding diabetes is alcohol.
Oh, okay, sure. Again, we want to be mindful of alcohol. I'm certainly not going to say you can never drink, because people will have some issues with that if they want to.
Yep.
So we'd say, how could I teach you how to drink safely? And the thing behind alcohol is to remember that there's a lot of different types of alcohol, so there's many different types of carbohydrate content in each of them.
Sure.
For instance, a Diet Coke, a vodka and Diet Coke is going to have less amount of carbs than maybe a sweetened drink, a martini, right? Like that has all this fruit juices in it. But the real key to alcohol, the message that we want to get across is what alcohol does when you take it in, it actually turns off the liver's response to put out sugar to save your life. So if someone were to not eat, maybe they took their insulin, they're waiting for the table in the restaurant, they're having a cocktail, and if their blood sugar is going low, that cocktail is going to prevent their body from saving itself. So we want to say, if you're going to have a glass of wine or whatever alcohol, have it with pretzels, have it with your dinner.
Yes.
So then you lessen that risk of low blood sugar.
And it tastes better that way anyway,
Sure, good.
in my opinion.
I didn't even know that. So I think that that's a really important piece that
Yeah.
probably a lot of people do
And
not know that.
didn't you mention something about Prosecco? People think that that's a really good thing to sip on, but it might not be for diabetics, right?
Well, again, everything needs to be sampled and tested, which my patients love that. Like, what, you're allowing me to have pizza, you're allowing me to have some Prosecco? Yes, but you have to realize that that has more sugar in it.
Yes.
So let's see how your blood sugars respond when you drink it.
Right.
And we don't get upset when their blood sugar goes up. Again, we try not to assign any emotion to blood sugar.
Yeah.
It's about learning. So I say, oh, my blood sugar went to 350, so we might not want to have that again.
Right.
That's what we learned from that.
That was me, Diane, by the way. Prosecco is made from the Glera grape, and that just has a higher sugar content than many other
Right.
grapes. So
Okay.
that's versus cava versus maybe a sparkling wine. It's just a very high sugar content grape. That's and as you said, some people may respond to it very
Yeah.
differently.
And what they're having with it.
right,
Right,
exactly.
Right.
Exactly.
Can you believe we are down to a minute?
No, we're not.
Wow, that went so fast.
I feel like we could
Yeah,
talk all day,
yeah.
right?
Oh,
So
goodness.
we would like to have you give some diabetes resources to viewers.
Sure. Obviously, we have the American Diabetes Association, always a wonderful resource. The Association of Diabetes Care and Education Specialists. beyond type 1. There's Breakthrough T1D, which used to be Juvenile Diabetes Foundation. And of course, Diabetes Insights LLC, my company as well, is a wonderful resource. I have free classes on that website for individuals to take, and they could also book an appointment to work with me. First visit is complimentary, and it's also there for professionals. So if you are a professional in the field, whether you're a healthcare professional or a certified diabetes care and education specialist, there's classes there for them to continue their learning.
I love that.
What is your website?
DiabetesInsightsLLC.com.
Awesome.
I love that. We're going to make sure to put all that information in
Great,
the credits
great.
so that people can reach out should they need more information.
Yes.
Wonderful.
Thank you so much for joining us. This has been very insightful.
Yeah.
Oh, it's
And
my
I love
pleasure.
the silver lining. I love your silver lining that it's positive, that,
Yes.
you know, it's a positive thing. It'll have you learn more about food and how your body reacts to it and the movement. So to me, that is a positive and it's a silver lining.
That's a perfect show for the topic. There you
That
go.
is a perfect
Great.
way to wrap that up, Diane, is you presented so many silver linings for so many people that they can thrive with diabetes.
Absolutely. Absolutely.
thank you so much
for
being
having
with
me.
us.
Thank you.
Thank you. And remember, always look for the silver linings.